before I even get into what you do and all the other fantastic things in Nebraska, let's talk about that zombies because that's going to get everybody's attention. It got my attention. Tell me about that. What was that?
I think this is really about innovation and how do you better engage with communities.
Yeah.
So we know that we need to be prepared for a disaster or a pandemic, right? But you can do it in a dry way, or you can try to somehow engage people. But I was routinely putting out an alert every year about the hurricanes.
And people weren't paying attention.
People weren't paying attention. Yeah, hurricanes, right? But the moment I said, hey, zombie apocalypse, everything except for the guns, obviously. No guns, but everything else, right? You got to have a go bag. You got to have a plan, right? You got to make sure you've engaged your community. You need to know where you're all going to meet. Almost all of the things that you would need for a zombie apocalypse. And all of a sudden, we crashed CDC server, and now they're actually teaching courses called the Zombie Apocalypse as a way to help people understand preparedness and response activities in their communities.
We spend a tremendous amount of time collecting the dots. We need to spend just as much time in connecting those dots. And that's what Public Health Connects is all about. My name is Dr. Umair Shah. I'm the Secretary of Health for the great state of Washington. This is Public Health Connect. Well, I am super excited about our next guest. This is part of our Public Health Connect series where we talk about not just collecting the dots, but really connecting those dots. And today we have Dr. Ali Khan here, a good friend, colleague, an amazing leader in all respects in infectious diseases, the dean at University of Nebraska Medical Center's School of Public Health. Did I get that correct?
Spot on. University of Nebraska College of Public Health.
Okay, got it. And I have to say that you were also there at CDC when their website crashed during something for emergency preparedness around the zombie apocalypse. So before I even get into what you do and all the other fantastic things in Nebraska, let's talk about that zombies because that's going to get everybody's attention. It got my attention. Tell me about that. What was that?
I think this is really about innovation and how do you better engage with communities.
Yeah.
So we know that we need to be prepared for a disaster or a pandemic, right? But you can do it in a dry way, or you can try to somehow engage people.
Yeah.
And so we knew when we put this alert out about zombie apocalypse, it was really about the hurricane season. But I was routinely putting out an alert every year about the hurricane season.
And people weren't paying attention.
People weren't paying attention. Yeah, hurricanes, right? But the moment I said, hey, zombie apocalypse, everything except for the guns, obviously. No guns, but everything else, right? You got to have a go bag. You got to have a plan, right? You got to make sure you've engaged your community. You need to know where you're all going to meet. Almost all of the things that you would need for a zombie apocalypse. And all of a sudden, we crashed CDC server, and now they're actually teaching courses called the Zombie Apocalypse as a way to help people understand preparedness and response activities in their communities.
Wow. It's a little kind of a related piece. After that, maybe a couple years later, when I was in Houston, I was actually listed in one of the top 10 people that you would want to have around during a zombie apocalypse. And so I was there for that purpose. So just to put it out there, I got some connection. Not sure if you knew that.
Well, if there's a zombie apocalypse, make sure Dr. Shah's on speed dial. Hey, Umair, what do I need to do?
Let's make sure you call the other 9 people. I'm number 10. Yeah. There you go.
No.
So I want to just start with that. But tell us about what you currently are doing with at University of Nebraska Medical Center and at the School of Public Health. I mean, fantastic things happening.
Well, we are having a blast.
Yeah.
So I've had the honor to be there about 10 years as the Dean of the College of Public Health after spending 23 years in Atlanta. Joined CDC as an EIS officer right out of my residency.
Yeah.
And so very much practice-based College of Public Health. And so we do educate our students, needless to say. We've become a global College of Public Health. We have students domestically. We have students in almost 40 countries right now. So we have a global College of Public Health. But I believe in education for a purpose, right? And so, yes, education is good in its own right, but how are you impacting your communities, right? And how do you use these new skills and tools and knowledge that we give you to say, how do we make make a difference in our communities. And it's not just at the level of our students, it's also what our faculty and staff think about all the time. How do they engage their communities to have an impact? I mean, you've heard me say this before.
Sure.
I do not need one more study telling me smoking is bad for me. Right? I need one really good study that tells me, how do I get people to stop smoking? Right? And so that is the mindset we approach everything with at the college.
I love that. I love that. So I'm gonna shift actually with that in mind. This real notion about community, and Nebraska has obviously Omaha, and there are some urban centers, but there's a lot of rural population, very similar to Washington. We have, everybody thinks about Seattle, and then you go on the other side of the mountains, or Southwest Washington, or other parts of the Olympic Peninsula. Rural populations, there is a lot of real talk, including here at APHA, that we're hearing people say, how do we reach people in communities that are not always the urban centers? Can you unpack that? You're thinking a lot about communications and engagement for populations that are in those settings. How are you going about doing that? What are you all talking about?
And actually, it really coincides with when I try to talk about equity. So often when we talk about equity, people immediately go to race and gender, and I go, why do you stop at race and gender, the two easiest things to see, right? What about rural populations? Anybody think about rural populations? What about ages of extreme ages, at both ends? So diversity goes so much deeper than just sort of the race and ethnicity thing. So Omaha actually is our MSA is about 1 million people. So
I did not know that.
Bluffs. So we're a pretty large urban population. Fabulous community. I'm going to invite you to come and visit.
I love it.
You will love it.
Do they have good ice cream? That's like my
we have one.
Lately, I've been into this ice cream craze.
Cornflower ice cream is rated as one of the best ice creams in America.
Okay.
Right down the street,
sold.
Right down the street from the college, and actually,
love it.
One of the best burgers in Nebraska was recently written up.
Oh, really?
By Alton Brown.
All right. Well, you got me on both fronts. Okay.
Great. Well, come on, we're agricultural community. So we understand farm to fresh better than probably anybody else in America. And we do have the best beef in America.
In
moderation.
Yeah,
always in moderation. But going back to rural populations. So 30% of our population in Nebraska is rural. Okay, so that's a third of the population is rural. We actually have the smallest city in America, population of 1. Elsie, who's the mayor. Who's the mayor? She owns the tavern. She's the librarian.
Get out! Are you
She's
serious?
Postmaster General. Yeah, population of N equals 1.
Wow!
Smallest city in all of America is in Nebraska, and most of those small communities have populations about 800 people or so. So these aren't big. There's a couple of sort of what we call micropolitan areas there, but these are small rural communities. And you think about, how do we reach these small rural communities, recognizing that in general, if you look at the top 10 causes of death, they're almost 2 times more likely to have premature deaths than other parts. And it's not just a function of distance. I mean, there is that function of access to healthcare and distance to healthcare, but there's all sorts of issues, and it's important not to lump or stigmatize these communities or profile these communities like, this is what your problems are.
Assume
Do
so much
not
about
make assumptions. You have to really go and learn, because we help with, given our role, as I said, we're practice-based. We pretty much help every community in Nebraska, and I probably see all the way, we're like a 500-mile campus, we like to say. So I crisscross Nebraska all year long, right? And we help with their sort of health assessments that they're required to do. And you go, wait, this health assessment isn't this one. And so it's different. And so you need to say, what is your need in your community? And then how do you address that? Is it mental health? Is it drug use? Is it heart disease? Is it cancer? And then how do you then make that happen? And that's where critical public health is so critical, right? Because that's what our public health practitioners do. They go there and say, what are your needs, and how do we work with you in solidarity with you, right? Because that's what approach we have to take around engagement, solidarity with our communities.
Well, and I love that, and I want to ask this question about receptivity. So oftentimes public health, at least of late, has really been under a microscope, if you will, right? And that microscope is that we're out of touch with, right? So I love what you said about this. Tell me what your community needs are. We're going to now try to work with you, but not without you. on that issue. How do you then unpack that of a community that may potentially say, well, I'm hearing all this in the media about negativity towards this field, and you're the person from that field showing up at my door asking me something or saying I'm here to help you. How do you unpack that?
So what I've been saying since the pandemic, I'm an old-timey public health person, I'll be honest with you, right? For me, it's always been about data, complete data, comprehensive data. I have changed my perspective over the last 4 years. And to me, the most important thing is trust, right? For all, and not that data isn't important,
Sure.
because you need to have the data for the trust, but nobody's going to do what you suggest or advise if they don't trust you, even if it's in their best interest. And the last time, you should never see your public health practitioner for the first time when he or she gets in front of a podium and says, you may not do X, or you may not
which
do
is what
Y,
happened during
which is what
the
happened,
pandemic, yeah.
right? And so they need to know that you've been there actually before they were born, you were there to make sure mom was getting good care, right? So you have been there for them all this time. And so when you get up in front of that microphone, they'll go, you know what? I trust them. I respect them. Yeah, I don't always agree with them because they're always nagging me about things that I don't want to do.
Right.
But I trust and respect this person, that what they're saying is in my best interest. And that's where we need to go as we think about each and every local communities. How do we build that trust? And that trust then allows you to have these conversations about what needs to happen. But you need to make sure you check your biases at the door every time. You're unconscious, and they don't have to be even conscious biases.
Right.
You're unconscious, but check them at the door. What is we work in support of our communities, right?
Yeah.
And what do they really want us to work on? And be respectful of what they want to work on, and be respectful of what that local culture is, which is very, very different in every community. I say in Nebraska, I would say I'm pretty much respected and trusted. However, and I have a good message, but I may not always be the best messenger, right? And how can we step back and say, you know what, in this situation, this community leader, this church leader, and this women's organization is the best messenger for that community, right?
Got it.
Right? So we don't have to be all things to everyone. Just
Yeah.
make sure that we're trusted and respected because of good science, and we come from an attitude and approach of we're here to work with you. What are your needs? Not what are my needs, right?
That's right.
Not does my grant say,
from
or
Omaha,
from
yeah.
academia even.
That's
Like,
right, academia.
I have a grant that says I'm going to do X to you, right? Are you ready to have X done to you?
Does not work well.
For lots of reasons, including the fact that the moment your grant is done, for all the good things you said, you're gone. So how do you think about that? And this is where, again, local public health, right? So we don't do anything that doesn't involve our local public health department, and obviously it involves the community.
That's right. So can we get there? So can we get there? I mean, we come with biases in our field, and we don't always reflect our communities, the diversity of the community, whatever the community looks like, right? And so we don't always know what's happening in the community, and then we come to the community and say, "Hey, trust us. We're here for whatever that is, or we're the expert, right?" Do you feel that we have the tools and the know-how and the ability to get there, to build that trust, or some people say build back that trust, if it was lost, if you will, over the last several years? Do you feel like we're moving in the right direction, or do we still have to take an inner look at our own tent and figure out what's happening with, under the covers, if you will, in the field of public health? Where do you think we fall in that?
I don't think those two are mutually exclusive. People know who and what public health is in a way that they did not know prior to the pandemic, right? I remember during the pandemic when, all of a sudden people are talking about these inequities that were occurring in terms of who was vaccinated and who was sick, right? And you see all these newspaper articles.
Right.
I'm like, this is not new.
We've had this before.
Before. But it was a way for people to recognize that what we work on and where our values are about equity within our community. So I think that was good for us. That said, we need to work inside the tent, as you say, to develop the tools on how do we work with our communities to learn what their issues are. And remember, I remind our students, we're also of the community, right?
Yeah.
Right. And so, and that means working on ourselves, what are our biases and how do we check those, as I said, check them at the door and learn from them.
And teaching those skill sets of
skill
communications and engagement, and how do we use social media and all things that we traditionally haven't.
Good point. And and what you're very, very good at is you're trying to reach your community. No,
I've learned.
You're very good as you think about how do you reach all of your community, and you recognize that when you said, Washington isn't Seattle, right?
Right.
And I like to say I'm the dean of the College of Public Health of Nebraska, not Omaha.
That's right.
Right.
That's right.
Actually, Nebraska.
When I first came into Washington, that was my first press briefing. I said, I'm not the Secretary of Health for one part of Washington, but for all of Washington, which I think is important for all of us to remember.
Yeah. And part of this is, I'm not somebody who believes like, if you're a Hispanic patient, you can only have a Hispanic doctor or something crazy like that, right? We have a common humanity, but we need to think about how do we understand and be respectful of other cultures, so that I don't want our public health practitioners to get hung up with, well, I don't look like the community I'm working in. No, you're human. You care about that community.
That makes a big difference.
Of course. Of course you belong there. You absolutely belong there. But please listen to the community, understand what their needs are. And they will embrace you if you come with that attitude.
That's right.
And of course, our public health professionals, you're not academics yet. You're not there for the short term. My grant's a 3 to 5 year grant. You're there for the long term. You are there for the long term. You are there for that community, being of that community.
As you know, our agency had launched a transformational plan 2 years back in August of 2022, and it's really based on 3 cornerstone values of equity, innovation, engagement. Equity, innovation, engagement. I'm curious if you have, as you hear those values, and maybe even the discussion we just had, do any of those speak to you particularly more so than maybe other values out there, or do all 3 speak? Can you talk about any of those or all 3 of those values? But really then I'd like to know would you maybe one example of how you would operationalize better than how we are maybe as a field currently doing. So equity, innovation, engagement, 1, 2, 3, 0, 5, whatever. Which of those resonate with you?
And congratulations to you for sort of putting that plan together, because again, it allows our community to say what is important to these people who are coming and showing up at the door, right? Oh, equity, innovation, and engagement. Right. And so public health, the foundation of public health is social justice, right? That's equity. That is the dignity and the health of each and every person in our community, right? Mm-hmm. That is where we start from, and how collectively, that's a public health part, how do we collectively change systems and policies to ensure that health and dignity of each and every person in our community as part of a larger society, right? Sure. So the equity is where it starts. The innovation and engagement is how you get it done. In my mind, that's how you get it done. I'll give you an example, and you need to innovate because we always have to think about what are better strategies to make things better in our communities, right? Mm-hmm. And it's not doing more of the same, right? You have to think about what's next and what is the good research and evidence base for that. But I'll give you an example from what we do. So a couple of years ago, we decided to put together something called the Align Coalition within the state. And this is the 2 health systems, so ourselves and Creighton is part of a health system that's run there. So the 2 academic centers, the health systems, the large accountable care organizations, long-term Medicaid services, Division of Public Health, state and local health departments, all of the insurers, all of the Medicare care organizations, and a couple of other key health partners. And we came together and said, we may compete on who has the nicest rooms and the best breakfast in the hospital or the nicest clinics, but we're not going to compete on the health of our communities. And so they all came together and said, here are 13 things that if we did them, if scaled up, so individually they would lead to good individual health, and scaled up they would lead to great community health. And you could even without me telling you, you as a public health practitioner would figure out that things that I'm talking about would be like vaccination and mental health screening of pregnant women. Right? You would come up with those right away. So these are the key things I think we would need to do in the community. And so we got everybody to agree on that. And then we've been doing a couple of projects, first starting with increasing, we had a low rate of colorectal cancer screening, increasing colorectal cancel screening by going into communities, health systems, and then providing them CMEs, providing them credit towards their maintaining certification for their licensures, et cetera, and then letting them see the data. We have found that nothing makes people more competitive than seeing the data on another clinic and going, wait, how have they got to 80% of screening their people?
62.
And I'm 62. So that was very effective. And our current thing is maternal child health. And this is not unique to Nebraska. You know, if you're a black baby in this country or a black mom, you're 2 to 3 times more likely to die than if you're a white baby or mom. And, you know, I'm a pediatrician and I look at those black and white and brown babies and I go, oh, they just look like babies to me, right? They all look the same to me. So why, based on something like their skin color, they're more likely to die in a year? Right? That's unacceptable. Is that the right? I can't find the right term for that because it just gives me so much anger sometimes as a pediatrician, right? Right. And so
in a country like this, where you have all the resources,
of the resources, and so, you know, the U.S. goal for maternal child health is 5. Japan gets us to 1.5 deaths, right? So we are saying that our goal is 2 times more than what's possible, right? Which is crazy. And then obviously then the discrepancy. So this whole community, this aligned community came together and says, we need to tackle this. And we are doing all sorts of things collectively in our community about how to get people quickly. So one of the key determinants of that is, as you know, is prenatal care, right? And so, you know, we have women coming in. I think the mean for some of our populations is like 18 weeks or so. And, you know, it's been a long time since I practiced medicine, but 18 weeks doesn't sound like the first trimester to me, right? So maybe a little bit longer, right? I'm also not all that great at math, despite my biostatistics degree, right? And so
you're accurate,
right? How do you drop that and say, no, the moment you're pregnant, you're pregnant, I want you to go see your doc, right? And guess what? Here in America, thank God, the moment, regardless of what your insurance status may have been before, you are now covered with health care.
That's right. That's right.
And so how do we let people know that? How do we enroll them in systems, especially systems that are administratively clunky, so that even if you're eligible, you can't really get the care you need? So it's not just about saying, hey, you have access to care. Oh, no, there's all sorts of pieces
to actually have access. That's right.
To have access. So we also, as part of this, because everybody's together, our state health agency said, wait, the database that tells us you're pregnant and the database that tells us we need to assign you to a clinician don't talk. And they're like, how did that happen? Right? So because they looked at their systems and said, what are some of these delays? And they're like, okay, we need to fix some of these things to address on our side to address these concerns. And so there's an example of being engaged with the communities. We work with the local providers, obviously, who provide the care. We work with the NGOs in the community that provide care to these women, who, you know, doula services, midwifery services, etc., across Nebraska. And so these are the conversations we're having: innovation and engagement, because it's
to advance equity.
To advance equity.
I love that. You are. I want to close with a couple of questions. One is going to be a personal question, so just keep that in the back of your mind. But the first is really very much about how I know you. And I know you as one of the most optimistic and hopeful people that I've ever come across.
Kind of you.
Always smiling, regardless of what the issue, whether it's a zombie apocalypse or it's somebody calling you because you crashed the server. I don't know which was worse. But I wonder if you could talk a little bit about hope for the next year. I mean, you know, we could certainly talk 20 years from now, but I just leave it to next year. We're at a critical time in our nation. We have an election coming up. We're at APHA. We're at the, you know, when this will be aired, it'll be at the, you know, close to the end of this calendar year of 2024. And it's hard to know what's going to happen, and predicting that is both a science and art, and I'm not sure anybody knows. We will get to the other side of January 1. We'll get to the other side of a new year, right? A celebration, something, commemoration. We'll be in 2025. What gives you hope for that new year?
So I have to say so many things. And so I'm going to answer your question first, right? One is, I don't think it matters to me who wins the election. We're public health practitioners. When I have a community in front of me, or as a clinician, when I have a patient in front of me, I have never asked, are you a Republican? Are you a Democrat? Are you a Libertarian? I need to decide to change my practices based on who you are, right? we care about the health of our community, and it doesn't matter
Of our people.
of our
Yeah.
people, right? That's what we care about every day. That
I love
common
that. Yeah.
the common humanity thing, and I think it would be not inappropriate to align public health with a political philosophy, right? I come from what some would
agree.
say a red state. We are doing amazing things in Nebraska. I know my deans and public health directors from other red states, as do you. You came from Texas.
Yeah.
Tell me you weren't doing amazing things in Texas.
We did incredible
You did
things.
incredible
Our
things in
team
Texas. Did
allowed us to
incredible
do-
things.
yeah, exactly.
So let's always remember that as public health practitioners.
Yeah,
Okay?
yeah. We forget that a lot.
We forget that a lot.
Yeah,
right?
yeah.
Do
I
we-
almost call it sometimes East-West Coast bias, or we talk about flyover states. We forget what happens, but I don't even think it's flyover states. It's flyover communities. Even within a state, we forget. How do we connect with everybody across that state?
Absolutely, because that's what we're supposed to be doing, right? Defining the right people, the messengers, the message,
Yeah.
to make sure that we connect. And so, again, I like to keep politics and especially partisanship out of public health as much as possible. Not that have such rose-colored glasses that I don't realize that policies may be different, right? Based on what the administrations look like. That obviously I recognize. The second piece is I am always hopeful, right, about public health because I see what amazing gains we have made for our communities, not just over the years, but over the decades. You know, at least in and even the last century, based on public health. Look at where smoking levels are in the United States right now, right? Like, who would have believed that?
We could have gotten there.
That we've gotten so low, right? And continuing to go low. Even things like vaping in our schools, teenagers are less likely to vape right now. So we have better tools now for the health of our communities. And so I'm always hopeful. I mean, at this session, I did something on conflicts and infectious diseases. And my closing comments was about hope and resiliency, because that's what I learned from communities, right? They're not victims who need to be saved by us, right? You know, like the savior concept, concept of public, I'm coming in to save you.
Yeah.
You know, you've mentioned it a couple of times that we can't do that, right?
Right.
And we can't do that, right? These are communities, and within these communities, there's resilience and there's hope. And how do we nurture that hope? And how do we source for that hope to say,
And how do we get inspired by those very communities?
exactly,
I love
to say, we're going to do better, and collectively, your health will be better at the end of the year. And these are the key things that matter for you, whatever it is that we're going to work on together to have you healthier.
Oh, that's fantastic. Okay, let me close with this. Let me pull this apple. This is our new initiative, just a couple months old, called Be Well WA, which is Be Well Washington. It is.
Brand of
Wait,
apple.
I'm not supposed to give it to you yet. You can't have it yet. The only way I'm going to give this to you is that this is our health and wellness initiative for pillars of movement, nourishment, emotional well-being, and social connection. Okay. And what we're asking our 8 million people is find your apple. And so people have, said, oh, my apple is jazz, or my apple is reading a book or walking the dog, something that gives them their health and wellness journey. So, Dr. Khan, Dean, sir, I ask you, I want to give this to you, and as I give this to you, I ask you, what is your apple?
Thank you very much. So going back to the theme of never answering your question right away. So I talk about...
Is that a theme? Wait a minute. Yeah.
I talk about the big healthy five when people... Because there's so many health messages out there, and your messages align well. The first one I tell people, if you forget about everything else, move. So always exercise, movement is first. Second is fruits and vegetables. So I find it more valuable to talk about what they can eat as opposed to what they can't eat.
Sure.
So did you put in your 5 fruits and vegetables today, Dr. Shah? Right?
Oh, yeah.
The third one for me is sleep.
Yes.
The fourth one is exactly what you said.
Emotional
well-being, social connectiveness, and the last one is don't poison yourself. So alcohol, drugs, etc. So these are my big healthy five.
I love that.
For people. So my apple always will be number one about moving. But you only let me pick one because connection. Because I know all the data on social connections and how likely I am to get demented or not. Although I may already be demented based on your assessment in the last 20 minutes of me. But I try aggressive. It's so easy in the world I live in to sit behind a computer,
And just type away.
work all day long, and then go to Dean-related functions at night to eat. And so for me, it's really important to try to get in some exercise every day, even if it's just a walk around the block, whatever. Just I gotta get up, I gotta move. So that would be my effort.
I love it. Thank you so much for the time. We could have gone so much longer, so much to unpack. Thank you so much. Glad there are no zombies in the room, but I really appreciate it. Thank you.
And I will remember to have you on my speed dial.
Number 10, not the first 9. Thanks so much.